So we'll start with Dr. Elbireer. And it took me a while to get over his resume, mainly basically because I think he has done a lot in the last few years, but he's mainly an expert in global health, both for public and private sectors. And he will be talking today about the global security and its effect. Thank you.
Thank you, Dr. Salma. And would like to thank all the attendees today. No, it's after lunch, we're a little bit sleepy, so I'll try to keep you up. It's best probably, because the somehow السماعات في القاعدة is not good. أحسن حاجة تحطوا الهيدفونز اللي جنبكم دي لو ما سامعين كويس. It's a lot easier إنك تسمع الزول. So I will speak in English. It's easier for me probably while I'm presenting this. So this is about the global health security agenda, and it has started around 6 or 7 years ago, and has been initiated as a result of several outbreaks that happen all over the world. And I'm going to tell you a little bit about it and the impact of that on the developing world, and particularly in Sudan, and hopefully, we could just shed some light in how this really affecting the medical services and the global health agenda in terms of how to make it happen and what are the issues right now that we need to deal with. So let's start with the leading causes of death in the world. And as you will notice that you would think that war is would be at the top, but reality is it's way at the bottom. There is not that many people die of war. The reality is most people are actually due to heart diseases and cancer, but that's not the picture you will see in Africa, whereby the infectious diseases are more prominent, and you will see that there is a lot more concerns down there for HIV/AIDS and respiratory infection, which is basically TB. The leading causes of death in Africa has changed a little bit during the last 5 to 6 years, whereby you will see that the TB has become the top in the last 2 years, and then HIV. It has not reduced. HIV is still the same, but TB has kind of just surpassed it. The diarrheal disease have always been number 3, and it's still down there. But also you look here, things like road injury, type of war, things like that, you will expect that there will be a little bit more in a place like Africa, but it's not. The disease is that there is so much suffering. So the medical need for that is definitely extremely important, and we will connect it right now to security. When you look an outlook in 2030, you will obviously see that it's no longer going to be the infectious disease alone. Now, you're going to add to that the non-infectious, whereby people, sedentary lifestyle, they kind of had an opportunity to sit, they don't move much, and you see people with the non-communicable diseases such as the cardiovascular, it will way out past everything else. So looking at this type of issues that's coming up, and the importance of developing the medical services in Africa and sub-Saharan Africa and in Sudan and generally speaking in the developing world is going to be extremely critical. Currently, we are falling within a category 5 of countries of least developed infrastructure in terms of healthcare. And that's basically where systems that you would not see a lot of medical care is available to less than 40% of the population. And I'm not talking about outside places like the capitals. No, even within the capital, there's not that much thing. And the services that's available are extremely poor. So world security, when you think of security, you typically always start with being, how can I be free of danger or threat? And typically healthcare is not somewhere there. You always think of protection from people trying to kill you, trying to mug you, nuclear wars, trying to see data security, all type of security that we keep talking about it. But But reality is the biggest danger that we face on Earth is really our health. As I've showed you earlier, that's what really will at the end of the day will probably die from that, due to health issues. And that's why it's extremely important as we move forward. And despite that, you will see that in many countries, what's been spent from the GDP, the gross domestic product within each country, is not more, especially in Africa, will not be more than 10%, mostly 6 to 5%, while you see almost 30% of the budget goes to military and military people, generally speaking. Of course, with globalization, it's becoming extremely important that people have this fixation probably in the last 20 years. How can we really make one big village with the internet? And now there is a little bit shift back where people looking more about nationalization of what's happening with Brexit. Even, when you look in South Africa, where this attacks, that happened to Africans that's coming as migrants, the same in the US, where they're trying to build a wall. So there is a lot of issues but just recently in the last couple of years, and it's natural people feel more, they feel they don't want to have things coming from outside. With biosecurity, it's also a big thing, things that, all these products that's coming from somewhere else, as you hear from Egypt, that we get all these vegetables in Sudan that people are suspecting it could be contaminated. So the biosecurity is also another area that's, within globalization that needs to be looked at. In the early 90s or mid-90s, we have about 2 million people died of Asian flu. And then as you go down, and you would never see a war that millions of people will die in, except, when it comes to diseases. So I'm just trying to make the point that it's extremely important. And even when it comes to health, the areas that everything that you hear about it when it goes to CNN, usually when there is Ebola outbreak. And there's only about 4,000 people died. It's not only, I know it's a lot, but still, when you compare to other things, it's only. Right now, we have an Ebola outbreak. You didn't hear about it. And the reason, because it's somewhere in the middle of Africa, and there is almost half of this number already died. We have over 4,000 cases right now, and there's about 2,000 died of it. The difference is, last time, some of these cases managed to get to the United States and to England, and out of all this thing that you've seen, there were only 11 cases. In the US, only 3 died, and in the UK, there were only 3, and they all recovered. So you can say the disparities with us, even though we think that we are kind of people in the world that they will really pay attention when there is some type of a disease or an outbreak. But reality is they will only pay attention when it's actually coming to their doorsteps. Otherwise, highly unlikely this is going to happen. So we really need to pay attention to our own borders and what we would like to do to protect that. I think it's lucky for us that at this time, the world is a big village. And it's a small village, actually, when you think about over 500,000 people, as we speak right now, they're on the air, going from point A to point B, going from Los Angeles to Khartoum, going from Khartoum to New Delhi, and going from New Delhi to Tokyo. So this just happens, and there is nothing people can do to protect it from that. And now, how is this have any effect? Of course, whenever you're carrying any disease, people are highly unlikely going to see it from outside. And you could put all the metal detectors and all the inspections, and you could have personal inspection, people still not going to detect it. Everything that we go through, and only thing that you can ask for is a blood sample, that you will be able really to tell if somebody is sick or not. Even if you ask for a blood sample, a lot of this new disease is undetectable. And they're not going to test, nobody's going to test for Ebola. I bet right now in Sudan, they just developed that test and brought it in like 5-6 years ago. Before that, it was never there. So in Uganda, for us, I worked in Uganda for a while to find this test, even though in Uganda, even in Sudan, the Ebola actually started in Sudan, during the 1960s. The first case was discovered there in South Sudan. And we never had that test until now when this outbreak happened. And I think came primarily from the West, when they came in with all these issues. So that's where we come to the global health security agenda. So the world got together and said, okay, we need really to find a way to protect ourselves from all these issues, which is we're very lucky because we're in the middle of that, because whatever happened to us, unless they locked us in Africa, it's going to be impossible to keep things out. So we will ride this wave and we will be able to use it. However, it has limits, because as long as it doesn't really flow outside our borders, it's highly unlikely people will pay attention to it. And that's where the international health regulations came in. That's in 2005. They're trying to regulate each minimum health package for each country. And in 2012, about 20% only of countries managed to meet this IRH goal. By 2014, only 30% of countries. Right now, there are about 50% of countries managed to meet this agenda or the goals that to be able to respond effectively to an outbreak. So there is a big gap, and people need to worry about that a lot. There is this paper came out a few years ago, and it's basically a framework, these infectious diseases with dimension of global security. And by putting it this way, obviously you trying to bring the attention to the leaders that, listen, guns are not going to protect you from a virus. And it doesn't matter if you can put, you could put 60% of your budget to protect your borders. But what's really going to kill you is that virus, once it goes and it's spread around. And that's really what healthcare need to focus on. And I think the focus on that's what's really going to make, especially in Africa, there will be a lot more attention paid to that dimension as we move forward. Why should we care about it? For the reasons I mentioned earlier, spread fast, we're not prepared, and economic impact. We'll talk a little bit about that later. So there were 3 areas, particularly detect, prevent, and respond. This is how the areas that they looked at, and there is about 11 particular segments within those 3 areas, to prevent avoidable catastrophes, to detect threats early, and be able to respond to them. Within the prevention, there are 4 packages. The antimicrobial resistance, I'm sure many of you here in the medical field have heard about it. It's a big problem. We'll talk about it a little bit. Biosafety, biosecurity, zoonotic diseases, and immunization. So with the antimicrobial resistance, it's a big problem, especially in places where it's not, it's very easy to get an antibiotic, and that's usually what we do. I mean, right now, even though I talk about this, but when I'm in Sudan, I get really sick, I go get an antibiotic. It's a lot easier, just get it out of the way. And unfortunately, it's becoming a way of life, and what's going to happen, it's really killing our people, because when the time comes and there is an actual disease, there will be an antibiotic-resistant kind of microbe that antibiotics not going to work on it. And the same, we feed them to animals, and the cycle goes on, so we want the animal to stay healthy, and it's really affecting us at the end. By year 250, we're expecting that there will be annual 4.5 million people dying in Africa because of this problem. So it's going to be a lot bigger than Ebola and a lot bigger than anything else that we know. Zoonotic diseases, also, we got to pay attention that 75% of most infectious diseases like Ebola, like avian flu, come transmitted from animals to humans. In Sudan, we have a very big animal population, and we really need to start paying attention to this area. And somebody was mentioning earlier in one of these presentations that where there is actually animals and people, they drink from the same well most of the time. I think somebody mentioned that yesterday. Can't remember who, but it's very true. I mean, we are really very exposed to this. Biosafety, biosecurity, and then the immunization. There was a study done in Bahri Hospital in 2018, actually, in May it was published. They found that about 18% of the women, they don't even know that there is vaccines that's necessary. That's Bahri, Khartoum, which is basically the capital, of Sudan, and you can imagine with the rest of the country where it will be. So there is a lot of education that we need to go through, and out of those 20%, 70% of them have no information about vaccine at all. They never heard about it, they never seen it. I think it's not, they think some people don't think it's important, 8%, and 12% they feel from needle. I mean, the 12% probably the most logical, it seems like it, I can see some people that kind of agree with that, a little bit, So, but again, at least, this is something that really to start being paying attention to and how important it is. The second package, detecting, which is the national laboratory systems, reporting, and surveillance, and the workforce development within each of these countries. And the national laboratory systems, of course, is really critical, especially last year, actually 2 years ago, I was the CEO for African Society of Laboratory Medicine. And one of the things that we do, we're just trying to see what labs, we're trying to develop labs in Africa whereby to become accredited, internationally accredited laboratory, just like the one you see here with NHS. So in 2015, there were only about 250 laboratories in the entire continent that were accredited. Out of those, 225 out of 250 were accredited in South Africa. The entire continent, there were only 25. So in 2016 or 17, now we're up to 390 laboratories. 290 out of those in South Africa, as you can see here, and the rest is, there's a little bit in Egypt, there are about 30 or something, and there's some in Kenya, because they developed their own accreditation services, which has helped a lot. The rest, Sudan, South Sudan, Central, Congo, there is no accredited labs. So anything that we do up there is basically a toss of coin. That's as simple as that. And it's really sad, but this is how it is. So there is a lot of work that needs to be done. And apparently a lot of people have done it in very close countries, so it's not difficult to be done. And that's something we need to look at. And there's surveillance, reporting, and the workforce development. Now, another issue. You see that there's so many universities that are open in Sudan. I can't even count them. They're probably close to about 30 medical schools, I heard, or 29 medical schools. So you get so many doctors that came out. Now, as you can see, the number of doctors we have in Sudan, which is basically, we have about 26.1 for 10,000 population. Great number, beautiful. But when you look at the nursing and midwives, we have less than 10 per 10,000 population. So you see that even the focus that we have within that revolution of education has not been real, because the doctor cannot work alone. You need an entire system to work with you. And that's going to be a problem moving forward. So these are the kind of things that I think is really critical as we move forward, we think about it, and we make it happen. The last package of response, the emergency operation centers, really important within each country to look at, but it's very high. Tech needs a lot of money, and a lot of the countries in Africa have that particular center developed already because of the funding that comes from the West and from the US. Of course, in Sudan, we didn't have that for the last 30 years, and that makes it impossible for us. So we have a long way to go to kind of build this type of centers moving forward. But I think at least now, thank God, that we hopefully will make it happen. So the challenge is that, to talk about it very quickly, I don't know what time, how's the time?
Time is up, actually.
Time is up, okay. So the challenges we have is that, the coordination is really a problem because there are many countries, and the gaps in implementation science. Let me just tell you a little bit about the cost very quickly. Now, the cost of economic pandemic, it's close to 300 trillion US dollars. That's how a 5-year pandemic will cost, 300 trillion. Now, if we would like to prepare for it, it can cost us only 22 trillion. It's not that much when you compare it to the thing. The amount of money we have right now that's been available within the UN, within the WHO, it's about 1.2 billion only to prepare for a pandemic. So you can see the issues that, as we present this to the leaders, it's really important to move this forward. So Ebola taught us a valuable lesson that global health security is only as strong as its weakest link. So we really need all to work to make sure that we connect that weakest link and make it happen. Thank you so much.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ميلاد.